So as we say goodbye to Dr. Bevilacqua, we are going to welcome our next presenter, Emily Campbell, who will be joining us for the next little while. And of course, she will be touching on the importance of nutrition and PKD. In summary, in recent years, the importance of nutrition and with PKD has grown in popularity and the knowledge tied to that. This presentation that Emily is going to walk us through will review current recommendations for sustainable nutrition changes and health benefits to manage PKD, so that patients will appreciate the health benefits of nutrition changes for this disease, be able to identify sustainable nutrition changes, and understand the foods to include in a PKD-conscious diet. Emily Campbell is a registered dietitian and certified diabetes educator with a Master's of Science in Food and Nutrition. She is the owner of Kidney Nutrition, where she supports those living with kidney disease all over Canada through group and one-on-one nutrition support. Additionally, she works at St. Michael's Hospital in Toronto, Ontario in the Renal Transplant program and Kidney Stone Preventions program. She is the co-chair of the Southern Ontario Canadian Association of Nephrology Dietitians and a two-time cookbook author for those living with chronic kidney disease. Emily is passionate about helping others digest the complex world of renal nutrition and supporting others in achieving their health and nutrition goals. So I'm sure many of you on this presentation today and those watching it will recognize Emily Campbell from our monthly PKDE newsletters as well, where we are blessed to have Emily contributing nutritional and wellness recommendations, advice, and recipes on a monthly basis. And then, of course, she is so kind to offer her time to us for presentations like this. So before we throw to Emily's recorded presentation, I'd like to welcome her here today and look forward to chatting with Emily during the live Q&A.
Hello, and welcome back to the 2023 PKD Summit. I am so excited to be here to talk about nutrition and PKD, what you can and should eat to manage PKD. My name is Emily Campbell, and I'm a registered dietitian and certified diabetes educator here in Canada. And I am so excited to be speaking to you about the importance of nutrition with PKD. I work with those who have kidney conditions, help them overcome the confusing world of nutrition to preserve their kidney function and improve their quality of life. As a dietitian, I love food, both eating it and cooking it, and I'm actually a two-time cookbook author. This topic of PKD nutrition is something I am passionate about, especially being a dietitian, but also knowing those living with PKD. With PKD, our food is something that we can control. Everyone eats, so we might be an expert about what our bodies need, but we also need to understand what has been coming up in the evidence. So today, we're going to be discussing some of the current recommendations for nutrition and PKD. And while the field of nutrition is ever changing, we're always learning things every day about how nutrition and PKD work. So it's important that we do think about sustainable changes when we manage PKD, as we want to live many healthy years with PKD. So the nutrition strategies that we think about, that we act on, we should be able to carry out for our lifetime. The information presented in this presentation are going to be general recommendations, and it's important that you speak with your healthcare provider for personalized recommendations based on your health and your blood work. So thanks so much for having me today to learn about PKD and nutrition. Let's dive in. The objectives of today's session will be to understand the health benefits of nutrition changes for PKD. We're going to identify some sustainable nutrition changes that you can start making with PKD and review some foods that you should be including in your diet with PKD. Nutrition and PKD. You know, the world of nutrition can be confusing and complex, but my hope is that throughout this session, we'll be able to break it down into clear information and actionable steps so that you can start preserving your kidney function. Today, we're going to be discussing current recommendations. So we'll be focusing on the up-to-date evidence in human trials. And while this is always changing and everyone's nutrition needs are going to be different, a personalized approach is really important. And a dietitian like myself or through your nephrologist can help you customize those recommendations. So We'll chat a little bit more later on how to connect with a PKD dietitian. But for now, let's dive into some of the foods we can and should eat with PKD. A healthy diet can have a huge impact on PKD. And even if you have normal kidney function, it's never too early to start learning about what foods you can do to slow the progression of PKD with diet. The top 3 things that we can start thinking about with PKD are sodium, fluids, and including more plants in our diet. In recent years, there's been a huge increase in nutrition information for PKD. At the end of the day, the goal is to reduce the cyst formation, and we do that to help preserve our kidney function. And this is done by reducing vasopressin levels, which is a hormone in our body that we're going to talk a little bit more about. And also about providing the right nutrients to ourselves. So when we think about, the basics of that PKD diet, staying hydrated by drinking the right amount of fluid can help you to slow PKD progression. Fluid is the first step when we manage nutrition changes, and having adequate fluids and hydration during our diagnosis can help to manage our cyst formation. With PKD, another diet change that also is needed to help lower our blood pressure is limiting how much salt or sodium we eat. High blood pressure is often the first symptom of PKD, and so managing blood pressure is really important. In fact, this is probably the first diet change that we want to do. Most Canadians consume about 3,600 milligrams of salt per day, and this is way more than we need. Plants are really important for PKD as well, and that's plants from vegetables or fruit, but also from plant-based proteins, because these help to protect our kidneys, they help to improve our urine pH, they can also help manage our blood sugar, our cholesterol, and with weight management. So there's so many benefits to plants with PKD. If you choose to include animal proteins, it's about eating higher quality protein and smaller portions of them when we do include them. But including plant-based proteins like tofu or different nuts and seeds and beans can help to manage the urine pH and the load on our kidneys. So they're really important for overall health. So we'll talk a little bit about this and why we want to start to include some of those plant-based proteins. And truthfully, many of us are used to eating very large portions of animal protein. When we go out for dinner, it's a 12-ounce steak or half a chicken. And we live in a world that's really promoted high protein intake. So we sometimes need to shift our mind to think about what our bodies actually need and what happens when we eat too much protein. We end up peeing out extra protein because it causes the kidneys to work harder. It can change the pH balance of our urine. And it can lead to other health conditions like, high cholesterol, depending on the types of proteins we're choosing. So many of us also don't eat enough plants, and that's including plant-based proteins or vegetables and fruits. So when we think about PKD, starting with plants is a really good point. Now, the basics of PKD diet is really an overall healthy diet that focuses on eating a lot of vegetables and fruits, limits the amount of salt and protein. And nutrition is important for those with PKD for many, many reasons. A healthy diet can help to slow the growth of cysts. This ultimately slows the decline in kidney function. And healthy eating can also help to control different side effects of common conditions like high blood pressure or swelling or metabolic acidosis or cardiovascular health. It can also prevent kidney stones. And a healthy PKD diet can help with all of these conditions. But most importantly, nutrition changes, they also can work similarly to the medications that we can use to minimize the disease progression. So these nutrition changes of fluid, sodium, and protein, they target the vasopressin receptor agonists. And when we can slow this down, it slows the growth of cysts, which then helps to slow the worsening of kidney function. And for many, many years, there was little nutrition recommendations about how to slow cyst formation and to preserve kidney function. Often when you had PKD, you weren't referred to a nephrologist until very late stages of the disease, or you were told there's absolutely nothing that you can do from a nutrition perspective. And if you did Google something, there's a lot of confusing information because the diet for PKD and the diet for CKD are vastly different. It's really only been in the most recent years, 5 to 10 years, that we've seen such a growth in the knowledge of PKD, and we continue to learn. 5 years ago, we didn't know that the PKD diet was different than the CKD diet. And now we know that this is a key area we need to focus on with our PKD patients. We now know that nutrition helps to reduce the cyst growth and formation, just like medications can. And the basics of this diet is called a low osmolar diet. And that helps to manage concentrations of the urine and then decrease cyst formation and growth. But nutrition also helps to manage blood pressure, control our blood sugars and our cholesterol, and all of these go together with PKD. So it's important that we get the right amount of nutrients to help maintain our health and our kidney function. And as a renal dietitian, my goal is to put together a personalized approach for you, because we often might not just have PKD. Sometimes there's other things we need to consider for our diet needs as well. Today, we're just going to focus on a PKD diet, but sometimes you might need to customize things to yourself. So the main things with PKD are fluids, sodium, and protein. There are some other nutrients that we're going to talk about. So let's dive into each of these categories and see what changes we can do to help manage our PKD. The first thing we're going to talk about is fluids. So fluids help to reduce cyst formation and growth. Water should be the first choice. Just clean, filtered, no sodium water, no sugar, no artificial sweeteners. And ideally, we want to aim for 3 liters per day. This is going to need to be individualized depending on your activity level and other health conditions. But we know that this large amount of water helps to lower that vasopressin, that antidiuretic hormone that causes the cyst to form. And it can also increase the plasma osmolarity concentrations in our urine, which then decreases the cyst formation and growth. So a common recommendation for those with PKD is to drink water, a lot of water. And, normally we start around that 3 liters per day. And the science behind high fluid intake is really similar to that recommendation of lowering our salt. They go hand in hand. When we drink a lot of fluid constantly, it reduces how much vasopressin our body needs to retain the water. And since less vasopressin means less kidney cyst growth, the better. And this has been shown in both animal and in human models. So this is why it's such an important recommendation. Now, when we think about fluid though, there are some considerations, right? So we need to monitor our electrolytes. So things like our potassium and our sodium can shift in our body when we have really high amounts of fluids. So getting your blood work done is really important. Another thing that's really helpful is our 24-hour urine collection, because it can actually help us to determine how much fluids you need and check the osmolarity of your urine. So speaking with your healthcare provider about getting those 24-hour urines done is really important. Now, for that 3 liters of fluid, most of it should be from that good old water. However, drinking 3 liters of plain water can get pretty boring. So some of my patients find it really helpful to experiment with infused water. Maybe you put some apple and cinnamon sticks or some lemon and mint. You could use other products like True Lemon or Lime, unsweetened flavored waters like LaCroix or Bubbly or Perrier are also really wonderful options to mix it up from time to time. And, when we're thinking about trying to get all of those fluids throughout the day, spacing it out is really important. Maybe you use a water bottle or a smart water bottle to help you meet your fluid goals. Track it on your fridge. Find a water bottle or a glass that you like drinking from, a bottle that you can bring with you. That way you can stay on track with your fluids regardless of where you are. A common question that I get about coffee is whether or not we can consume those. So of course, water should be majority of our fluids. Coffee, it doesn't have a statistically significant increase in size of the kidney cyst. So right now, the recommendation is to keep caffeine to less than 2 cups of coffee per day, or 4 cups per day of tea is recommended. And I've been focusing a lot on all these beverages that have no added sugars in them. So water, right? When we choose fluids that have sugar in them, like coffee with sugar in it, tea with sugar in it, sugar sweetened beverages like pops or juice, there are some studies and some newer evidence, not in animal models, but in a general rodent models, that added sugars can increase our cyst growth. So we're going to talk a bit about that in a little bit later, but we also know that reducing sugar sweetened beverages from a health perspective, regardless if we have PKD, is important. So From a fluid perspective, we're going to focus on water. So, drink as often as you can, take it with you, have a bottle that you really enjoy drinking from, and flavor it with with any fruits or herbs or that you enjoy. Another thing is, if you do like tea, you could do an herbal tea or a green tea and infuse it with sparkling water is another really nice way of getting some different tastes without the sugar in your diet. The next strategy with PKD is sodium. So sodium is something that we're always worried about in the kidney world. No sodium is not better than low sodium. So there is still a role for some salt in our diet to manage our electrolytes, as well as make sure we're getting enough iodine. And whole foods are obviously going to have less sodium naturally in them. And adding seasonings like herbs or spices or citrus is a really great way to provide flavor. So when we have PKD, we often will also have sodium sensitive hypertension, and this can cause cysts to expand. And that can cause kidney disease to progress. So high salt, though, is also associated with this vasopressin release. So too much salt in our diet increases vasopressin, and we want to decrease vasopressin. So that is why we really want to start a sodium restriction in the early stages of PKD, not just to manage blood pressure, but as well as cysts. So a 24-hour urine can actually help us to determine personalized targets for sodium restrictions, because we can see how much salt is in your urine in that 24 hours you were consuming. But generally, the recommendation is to limit it to 2,300 milligrams or salt or less per day. And that's the same amount as 1 teaspoon. So the same as our tip of our finger. But that's salt from everything, right? That's salt from our foods naturally. That's salt that's added in things like bread or milk or cheese. That's salt, from foods that we eat outside of the home, like at restaurants. It's salt, that 2,300 milligrams is salt from everything. So how do we follow a low salt diet? Well, reading the food label, looking for those foods that have less than 5% daily value per serving can help, because 70% of the salt we eat actually comes from packaged foods. It's not necessarily from the salt that we're adding at the table. Choosing fresher foods more often. So using leftover meat from dinner as opposed to using deli meats. Flavoring foods with herbs and spices. Cooking with low sodium sauces or broths. It takes about 14 days for our taste buds to adjust to eating a low sodium diet. So stick with it, try new recipes, slowly reduce your sodium. If you use a teaspoon in your cooking right now, maybe you try to use half a teaspoon next week, and then keep reducing it as much as you can. Reading those food labels and sticking with it. This is a challenge when we're trying to make changes, because we're used to things that have a lot of salt on them. But stay with it. Add a lot of different seasonings like lemon or different herbs like oregano or garlic or ginger. That can help give you a lot of punch of flavor without the salt. Protein. Now, too much protein can cause kidney hyperfiltration, which stimulates the renin activity and then increases our blood pressure. It also increases our urine osmolarity and vasopressin, as well as causes high acid load in the urine. But protein is really important for maintaining our muscle mass and fighting infection. So too much protein can increase our blood pressure and increase our risk of developing cysts. But too little protein can cause muscle loss, which will increase the creatinine. It can also lead us to have difficulty fighting infection. So the right amount of protein is going to be different for each person. And it's based on your height and weight and your activity level, but also a measure of the urinary urea on your 24-hour urine can help to determine the protein intake sweet spot for you. And compared with CKD, those who have PKD, they don't need to follow a low protein diet. So some studies on a low protein plant-based diet show promising recommendations, but there's no concrete recommendation yet. And targeting, a normal moderate protein diet is really kind of the focus right now. More of the goal with protein is to reduce the serving size of animal proteins, to something that we would more be representative of what we're eating. So about a 3 to 4 ounce serving. I was talking about that 12-ounce serving or that half a chicken before. That's quite a lot of protein. So, thinking about that size of your palm when you're trying to look for things like meat or poultry or fish. Or the other thought is to just include more plant-based proteins. Not only is that good for the pH of the urine, it's great for our heart health and managing our blood pressure, and it can help with weight loss as well. So we don't need a low protein diet, but we need to make sure that we're getting enough protein. Other strategies are, including more of those plant-based proteins like nuts and seeds and beans and legumes and tofu. Maybe you look for a meatless Monday, or focus on having breakfast and lunch as more plant-based. Half a cup of tofu has 12 grams of protein in it, compared to that kind of palm size of chicken or fish is closer to about 24 grams. So these vegetarian proteins are also so versatile, right? Tofu is great in stir fry or roasted in the oven. Nuts can be added to soups or salads or oatmeal. Beans can be replaced in tacos or pasta dishes. So super versatile and can and should be included in our PKD diet. It's okay if you still decide to include animal proteins. So there's no concrete recommendation that we need to avoid these, but it's how much we're having when we have them. Some other considerations, at this time, there's very few human trials to date on nutrition and PKD. And maybe you've heard about keto diets for PKD, and there's some encouraging data that's growing, but there haven't been a lot of human trials yet. So some concerns with keto in PKD is that it can increase your risk of cardiovascular disease and kidney stones and liver cysts. So there also are, things to consider, right? When there's not enough evidence, this is changing. And when we think about it, we also need to think about the risks of following a keto diet. So not monitoring ketones, tracking our intake can be tedious. Having the skills to be able to meal plan and meal prep, not relying on these keto-friendly products that might be higher in salt. Often when we follow a keto diet, we don't get enough vegetables or fiber, and this can lead to constipation or can change the acid-base balance. So right now, there's not enough concrete recommendations, and what we really want is something that's going to be sustainable for the long term. Compliance and sustainability with keto diets can be a concern. So instead of focusing on, getting rid of every single type of carb that we're having, thinking about the quality of the carbohydrates and the portion size is a little bit more sustainable. Maybe in the future we'll have different recommendations, but right now focusing on, a low carbohydrate versus a keto diet, because most of us overeat in carbohydrates, might be another way of thinking about managing PKD. So choosing, lower glycemic index carbohydrates like steel cut oats or barley or squash, as opposed to more refined carbohydrates like white bread, potatoes, white pasta. And then looking at the portion size, right? Maybe aiming for a quarter of your plate or 1 cup per meal. So keeping those portion sizes in check. High blood sugars is associated with faster disease progression of PKD, and reducing refined sugars and added sugars is important. These free or added sugars, they come in many forms. So there's white sugar, brown sugar, molasses, honey, maple syrup, corn syrup, like high fructose corn syrup. And these are added to foods and they don't have a lot of nutrition value. They cause an increase in blood sugar, especially if we have diabetes. And some of the most common sources are those, sugar sweetened beverages like pop or juice or specialty coffees, baked goods, candies, chocolate. And it's estimated that Canadians eat about 110 grams of sugar per day. That's 26 teaspoons. And that is sugar from all sources. So too much free sugars and added sugars can lead to cyst progression in PKD in animal models. But they also can lead to gout, high cholesterol, and difficulty managing blood sugars when we have diabetes. So the current recommendation for added sugars is to try to reduce it to between 5 to 10% of total calories per day. And if we think about that 5%, that's about 6 teaspoons of sugar. 1 can of pop has 10 teaspoons of sugar in it. And so we can read food labels to see, how many grams of sugar and what percentage of daily value it has in it. Trying to choose foods with 5% daily value or less for sugar can help us to choose things that will have less added sugars. Choosing whole foods, right? So instead of fruit juices, you have a fruit, right? Clementine as opposed to the orange juice where you're going to get vitamins and fiber in addition to quenching your thirst. trying to avoid those sugar sweetened beverages. And, it doesn't matter if it's honey or maple syrup or corn syrup or white sugar or brown sugar, it is all sugar. So, trying to find ways that we can limit these added and free sugars into our diet. Instead, choose foods that naturally contain sugars like vegetables, fruit, milk, in reasonable quantities can help to manage our weight, help with healthy eating habits, manage our blood sugars, and PKD. Another thing to think about is potassium. So including potassium sources can actually help to manage our blood pressure as well as prevent kidney stones. Now, not everyone needs a potassium restriction, and this is something that we often read online about. It really does need to be individualized based on our blood work. And some foods that are great sources of potassium that we can certainly include are nuts like pecans or pistachios, or seeds like pumpkin seeds or sunflower seeds, kale, asparagus, bok choy, mango, pear, papaya. These are all really great fruits and vegetables that we can include. From a phosphorus standpoint, this also needs to be individualized based on our blood work. And so one thing that we all should be doing regardless of our phosphorus values in our blood, because not every doctor checks that, is we want to avoid foods that have this added phosphorus. And that's identified as this PHOS in the ingredient list. And when we have too much of this added phosphorus over the long term, can lead to weakened bones and vascular calcification, so the hardening of our blood vessels. So we all can avoid some of these added phosphorus foods, but whether or not you need a total phosphorus restriction really depends on your blood work. I want to talk a little bit about fat sources. So with polycystic kidney disease, it increases our risk of cardiovascular disease, like high cholesterol. And high-fat diets can also worsen our PKD outcomes. So we want to do a few things to help. The first is, of course, reading food labels. So we're going to read our food labels for salt, we're going to read them for sugar, and now we're also going to look at them for fat. So trying to find foods with 5% or less for saturated fat, and avoiding foods with trans fats. This is one strategy we can do to help manage our cholesterol levels as well. One common source of fat in our diet is dairy products. Now we know that dairy products are also a great source of calcium, so the types of dairy products we choose is important. Trying to limit those high-fat dairy products and instead choose things like 2% or less for milk or yogurt, or 20% or less for cheese. So things like mozzarella or Swiss, Havarti, all goat cheese, all really great calcium sources and lower fat dairy products. But also large portions of animal protein like beef and pork or chicken with the skin on it can have quite a lot of saturated fat in it. So smaller portions of animal protein, not only does that help with the osmolarity of our urine, but also helps with the fat sources in our diet. And instead, choose heart-healthy fats. Like, this is all about what we can and should be eating. So let's talk about the things we want to have in our diet. Using things like olive oil or avocado oil, nuts like pecans, pistachios, seeds like pumpkin and sunflower seeds. These are all great things that we can incorporate in our diet. And, you might be sitting there thinking, I also have kidney stones, so I shouldn't be having nuts or seeds. Our urine can really help us personalize recommendations for oxalates, and individuals with kidney stones, their PKD will progress quicker. There's a lot of confusing information online about oxalate amounts and kidney stones, and pecans, pistachios, pumpkin, and sunflower seeds are considered low oxalate nuts and seeds. And that's why working with a dietitian can really help you find a diet that can help manage all of your conditions. So, if you're at risk of developing kidney stones, that 24-hour urine is also a really important thing to help with determining what level of restriction we might need for oxalates. But that's not an everyone thing with PKD. So if you want to incorporate nuts and seeds into your diet, pecans, pistachios, pumpkin, and sunflower seeds are definitely the best ones to look at. Some other considerations, right? Because when we think about lifestyle changes, nutrition is one aspect, but there are some other things we can do to help manage our PKD. So physical activity, of course, speaking with your healthcare team before starting any new activity routine, but aiming for 30 minutes of light to moderate walking each day, or cardiovascular activities like biking, swimming, participating in strength or resistance exercises twice per week. Managing our stress. So setting aside time to relax with things like reading or yoga or journaling, talking to a friend, a spiritual leader, a loved one, or a healthcare professional, getting a good night's sleep, aiming for 7 to 9 hours of sleep per night, having that sleep hygiene, going to bed at the same time, avoiding those technology, letting ourselves relax, and getting up at the same time each night. And then, of course, our mindset and our outlook. Those are all important things to consider when managing our stress. Also, stopping smoking. Smoking can increase our blood pressure and cause hyperfiltration on the kidneys, and alcohol. So, of course, the kidneys need to filter out alcohol, and avoiding alcohol can also help to preserve our kidney function. So you might be asking, then what should I do? The best diet right now is one that's personalized to you. And at the end of the day, the diet should really model this low osmolar diet, which is, high in water, low in sodium, moderate amounts of protein, low protein compared to what many of us eat, moderate calories to control our body weight, and low in glycemic index, meaning low sugar, high fiber foods. Basically, this is like a Mediterranean or a DASH diet. And the Mediterranean and DASH diets are really evidence-based eating patterns that we can follow to improve our health. And there's so much more literature now on the role of diet and our health, and this is going to continue to grow. But the best diet for PKD is going to include, appropriate amounts of water. It's going to incorporate plant-based proteins and limit the amount of animal proteins, but have a moderate intake overall. And that moderate amount is going to look different for everyone. It's going to be low in sodium and low glycemic index foods to manage our urine osmolarity. And it's going to have a lot of vegetables and fruit in it. And we can use these 4 points to help build a PKD-friendly diet. So let's take a look at the Mediterranean and the DASH diet. The Mediterranean diet, it focuses on a lot of vegetables, fruits, nuts, seeds, legumes, whole grains. It's low in sodium and uses herbs and spices, and of course includes heart-healthy fats like olive oil. And it limits a lot of processed foods, added sugars, refined grains, and sodium. And I love this idea of the pyramid for the Mediterranean diet. So it also incorporates, eating with others. So sharing our meals with others, physical activity, and it's more than just the nutrition, it's also our lifestyle. The Mediterranean diet is focused on whole foods. And as we think about this pyramid, it's making vegetables the main part of our meal. The Mediterranean diet is much more an eating pattern that focuses on whole foods as opposed to a strict meal plan. And if we think about small ways that we can add more vegetables to our meals, like maybe adding some arugula and peppers to our eggs, or, loading up on avocado and cucumber on our sandwich. Maybe we have an apple with nut butter for a snack instead of crackers. Looking at ways of incorporating more of these plant-based proteins in our diet as well, right? And limiting things like red meat, or maybe you swap beans and legumes into your soup as opposed to chicken or beef. Maybe you swap white rice and pasta for more whole grains like bulgur or barley or farro. Whole grains are part of the mainstay of the Mediterranean diet, not just from the cholesterol lowering and blood sugar aspect, but also from a fiber and B vitamins. The Mediterranean diet, it limits things like processed foods, like cookies and cakes, and those added sugars and sweetened beverages. And so, when we think about this pyramid focusing on water and all of these great sources of omega-3 in our diet, like nuts and seeds and fish in moderation, really great ways of incorporating a variety of different foods that can preserve our kidney function as well. The DASH diet, on the other hand, it is based off of the same vegetables and fruits, whole grains, but it focuses a bit more on dairy products. It also includes fish, poultry, beans, and nuts, and limits foods that are high in saturated fat, like fatty meats and full-fat dairy products. When we think about the DASH diet, it looks at, the different patterns of eating we can take a look at from perspective of serving sizes. So it really focuses on making sure we're getting 4 servings of vegetables and 4 servings of fruit per day. So that might be 1 cup of raw leafy green vegetables, or half a cup of cooked or raw vegetables is just 1 serving. 1 medium fruit is 1 serving. And for the day, we want 8 of those servings each day. So aiming for half of our meal in vegetables at each meal and having fruit as a snack can really help us to get to these targets. Buying vegetables in season are often less expensive. Buying fresh or frozen vegetables are also really great choices. So depending on the time of the year, those frozen vegetables are going to have just as much nutrients in them compared to fresh ones. And it's okay to buy canned and water as well. So, fruit cups that often come in the water, these can be really great convenient things as well, or frozen fruit. Are all really nice things to incorporate into our diet. With the DASH diet, it focuses on those whole grains, right? Whole grain breads, whole grain pasta, cereals like all bran or oatmeal. This whole grain is important because it has a lot of fiber, has all of those vitamins in it. Helps to soak up cholesterol and really help to keep us full. And again, those low-fat dairy products, so things like milk and yogurt that's 2% or less, or cheese that's 20% milk fat or less. And the DASH diet actually says to have 2 to 3 servings per day. So that might be, milk in the morning, a yogurt, and then 1.5 ounces of cheese later on in the day. Focusing on dividing our protein throughout the day, regardless of what eating pattern we have, we want to space it out. That way we can keep ourselves full. And, using that palm of our hand as a really great kind of measure. And whether we follow the DASH or the Mediterranean diet, incorporating heart-healthy fish like salmon, trout, mackerel, fresh or even canned low sodium are components of these diets, as opposed to focusing on like beef and pork and lamb. And one thing, because of how the DASH diet works is it has things like calcium from our dairy products. It has things like magnesium and potassium from our nuts and seeds. So, 1/3 of a cup of nuts is 1 serving, or 2 tablespoons of peanut butter. Maybe you add them to your rice or salads or oatmeal. Because of these DASH diets that have more nuts and seeds and legumes and dairy products, there actually is association with a reduction in kidney disease. And regardless of what type of diet you choose, heart-healthy fats, right? So things like olive oil, limiting our added sugars, so cakes and cookies and sugar-sweetened beverages. Those types of diets can really help to preserve our kidney function, improve our overall health quality, but still show us ways of emphasizing whole foods, regular physical activity, and is not a strict diet, right? These are lifestyle changes. And nutrition is so much more than just nutrients and food. It is impacted by our socioeconomic status, our access to cooking and facilities, our food skills, our ability to prepare foods. So I know a lot of us are busy people, so finding foods that you're already eating and modifying them into the Mediterranean or DASH diet is a really way to be successful. And following a Mediterranean or a DASH diet, it doesn't need to be complicated. So, when we think about it, we're always aiming for our water. Again, that 3 liters, that might be different depending on your health needs. And then looking at different ways we can streamline our food. So, maybe you switch to a low-fat yogurt. Maybe you add some strawberries and cinnamon on it because we're choosing a plain yogurt. Top it off with some sunflower seeds and some low-sugar granola, right? Looking for that 5% daily value or less for sugar. Maybe at lunch, instead of a deli meat sandwich, you have a mashed chickpea sandwich on whole wheat bread. Add some lettuce, some cucumber, some bell peppers, tomato slice, and serve it with an apple. At dinner, if you're used to having pasta with a meat sauce, maybe you use 3 ounces of chicken or tofu or fish as opposed to red meat. Use a whole grain pasta. You could certainly even add some low sodium cheese on here, and that would get you another calcium serving if you needed one. Things like garden salad with olive oil or vinaigrette dressing, and then maybe you have a nectarine as dessert. And of course, some snacks, some unsalted pistachios and grapes, or celery and hummus, or even, some veggies and cheese would be another great option too. So when we think about, our diet with PKD, there's lots of colorful and delicious foods that we can have with PKD. And, a healthy eating pattern, it really focuses on vegetables and fruit. So aiming for half of our meal in that. Choosing a protein and prioritizing those plant-based proteins more often. And then being mindful of carbohydrates. So choosing those whole grains and being aware of those portion sizes. But when we think about nutrition recommendations, there's no one size fits all approach. It's more important to make small nutrition changes gradually that can help you stick with it in the long term. We can't go from eating no vegetables in a day and having a high salt diet to then adopting to a Mediterranean or DASH diet each day. Thinking about a small change that we can make and really doing well with that can help us to make these nutrition recommendations be more sustainable. So focus on your plate, focus on one meal, maybe it's breakfast, right? Make sure that there's vegetables or fruit, make sure there's a whole grain, and look at what protein source you're going. So, or maybe you aim for, one meal that follows the DASH pattern per day and build up from there. And use those easy time-saving preparation techniques. So frozen vegetables are great if you're worried that they're going to go bad. Cut up vegetables are already a great strategy. Bagged salads, top on your own oil and vinegar dressing, or the trays of fruit can really help us to eat more vegetables and fruit. Look at different cooking ways. So crock pots or one pot meals or one tray meals that are filled with lots of vegetables and then you roast them. This can help us to add a lot more color, a lot more fiber into our diet, but not require a lot of food skills or time. And that makes making diet changes much easier. So maybe you try to add a serving of vegetables at lunch one day, and then the next week you focus on dinner. And then by the end of a couple of weeks, you'll have really balanced meals. So always aiming for half of it in those non-starchy, really colorful vegetables. Maybe you try to include 2 vegetables at each meal. Look for a salad with some olive oil-based dressing. Maybe you have fruit for dessert. It doesn't matter if it's frozen fruit or vegetables. Either one is perfect and very nutritious. Try to incorporate more of those whole grains. Instead of white rice, maybe use brown rice, or maybe use barley or bulgur once in a while. Swap out your breakfast cereal for something like oatmeal. And then look for ways that you can incorporate more of these plant-based proteins. Maybe you swap in some beans in your tacos. Maybe you add some tofu into your stir fry. And then sodium, right? We have to go back to those basics. So look for sodium-free spices like Mrs. Dash, BC Blue Menu, McCormick's, Clubhouse. They all have no added salt seasonings. These are different than salt substitutes. We want to avoid salt substitutes. We just want the no added salt products. Look for no added salt canned vegetables or broths. There's a big difference between regular low sodium and no added salt broth. So always looking for the no added salt products. Don't add salt when you're cooking your rice or your pasta or your hot cereal. Season things with herbs and spices, or look for low sodium seasonings when you're buying. There's lots of great brands out there, even for ketchups and teriyaki sauces and all of these great options that we can use to flavor our food still, that is still quite low in sodium. Remember that 5% rule when you're looking at the label. And at the end of the day, it takes a little while for us to get used to changes. So stick with it. It takes time for our palate to adjust, and there's lots of people out there to help support you on this journey. So, dietitians are those trustworthy, incredible source of nutrition information. Many of your extended health insurance plans cover registered dietitian services, and a doctor's note is not required. Dietitians within private practice with PKD knowledge are available to help you understand your personalized needs based on your blood work and urine tests to help you put together a plan that meets your needs, plan your meals, and delays your progression of PKD. But also your healthcare team can help support. So there's dietitians within your nephrologist office, and your healthcare team can also help to arrange that 24-hour urine collection for really personalized PKD recommendations. So speaking with your healthcare team, your nephrologist office, to see if there is a dietitian there is also a really great area for you. Oh, I hope this was helpful, and looking forward to chatting with you to answer some questions. Have a great day.
Well, I should not have gone into that presentation on an empty stomach. I'll tell you that much, Emily. That was fantastic. Thank you for joining us for the live Q&A. We have a lot to run through, Emily, so if you're ready to roll, we will rapid fire some questions. And then I'll just emphasize, because this is a hot topic and we do have a lot of questions, but we need to keep the afternoon on a tight schedule. Any questions that we're unable to answer during this webinar, I have written them down. We will get them answered offline between Emily and myself, and we'll send them through. Okay, so with that said then, Emily, are there recommendations for serum osmolarity in urine collections?
Yeah, so doing a 24-hour urine provides us with a lot of information. One of them is the osmolarity. Current goal is to have less than 280 milliosmoles per kilogram. So basically, when you collect your urine for 24 hours, it tells us things like the volume, how much salt, how much protein, how much oxalates are in there. And we can kind of personalize diet recommendations for that. So if you haven't done a 24-hour urine, speaking with your nephrologist to have one done is a great starting point.
Amazing. Thank you. Let's get some plugs in for the great work that you're doing. We have one individual that is asking where they can purchase your cookbooks. They've been looking for a good renal diet cookbook for years. And then let's just piggyback off that and plug your online support pages as well.
So you can purchase my cookbooks on Amazon. They are called the Renal Diet Cookbook for Caregivers and the Complete Renal Diet Cookbook. If you go over to my website, kidneynutrition.ca, I also have hyperlinks for them.
Amazing. Okay, we have the next question then is it better to eat higher phosphorus non-animal protein and take a phosphate binder than to avoid the high phosphorus altogether?
So this question has a few points to it. So we now know that the bioavailability of phosphorus is quite different than what we previously expected. So for example, animal-based proteins are absorbed at around 60% phosphorus rate, whereas plant-based proteins are absorbed at about 40%. These inorganic sources from like phosphate additives are 100% absorbed. So we always want to avoid those phosphate additives, so that PHOS on our food labels. Most patients with PKD don't need a phosphorus restriction. We would really only need that at very late stages of the disease. And again, checking our phosphorus levels helps us to do that. Eating higher phosphorus non-animal-based proteins, again, they generally have less bioavailability, so we're not going to get so much phosphorus from them. Similarly, with the high phosphorus foods, we really just want to be avoiding those phosphorus additives. Phosphate binders, there are a lot of health considerations in the long term from bone health, so we don't want to start those until we do need them.
Understood. Okay, thank you. Our next question, any diet suggestions for patients with PKD and high uric acid?
Yeah, so this goes down to a lot of the protein aspect. So we live in a world that tells us we need to eat a lot of protein, and particularly animal-based protein, and that's what increases the uric acid because they have purines in them. So adopting more of a plant-based diet can help from a PKD and a uric acid standpoint. If you have high uric acid, this can also put you at increased risk of forming uric acid kidney stones. So again, that moderate protein diet and more plant-based proteins is really helpful.
Great. Okay, the next question. I'm in renal failure and on dialysis. My GFR is 4. I understand that many vegetables, squash, spinach, broccoli are high in potassium, thus should avoid them. Same with tomatoes and oranges. Has any of this changed?
So those are high in potassium for the spinach, squash, tomatoes, and oranges. Generally, individuals only need to avoid high potassium foods if they have a high potassium in their blood value. And even that being said, we can still incorporate small portions of these foods because essentially we have, a potassium budget per day. And depending on how much and how often we're having some of these foods, they can still fit. But the reason for potassium going high is not always diet related. It can be related to constipation. Certain medications like blood pressure medications release potassium in the body. Our diabetes management, all of these things also need to be considered when we look at potassium values. So if you've been told to follow a low potassium diet, I would definitely speak with your dialysis dietitian to see what you exactly need to be doing.
Great insight. Thank you. Staying on the topic of spinach, then, the next question says, is spinach good to eat? I've heard it can cause kidney stones.
So no one food is ever going to cause a kidney stone. Spinach is often highlighted because it has oxalates in it. Not everyone who has kidney disease needs to avoid oxalates. So that's why getting your urine tested is really important. We often think about spinach because it's a leafy green and it has lots of great iron and other nutrients in it, like calcium. So there are many other lower oxalate, very delicious foods like bok choy, arugula, romaine lettuce. All of these things can still be included if you do need to follow a low oxalate diet. But checking your urine and seeing if you are at risk of forming kidney stones would be a better starting point.
Great, thank you. We have time for 2 more quick questions, and then the rest I'll private message with my email address so that we can get them answered after the summit. What are some healthy ways I can include more calories to my meals in an effort to gain a bit of weight? I'm not an unhealthy weight, but would like to add an extra 5 to 10 pounds given my height. They're asking about more olive oil being the solution. They love eating the Mediterranean diet, but find it to be lower in calories than their daily requirement, and sometimes they add olive oil to their drinks to get more calories.
Yeah, so you're already doing a really great strategy if you're adding a bit of olive oil into your diet. It's a great heart healthy fat, but you can also look at other ways of getting in calories. So, incorporating nuts and seeds into your diet. Avocado is another really great way of adding in some fats. Certain, smoothies, right? You could use kind of a 2% yogurt, some fruits and vegetables, maybe put some nut butter in it, just give you some liquid calories in that sense. Really, managing weight gain or weight loss with any kidney condition, it does need a personalized approach. So thinking about, where you are right now and different strategies of adding some calories, a tablespoon of olive oil on your soup. Maybe when you have salad or vegetables, you add a little bit more olive oil to that. But olive oil isn't the only way we can add calories. We can also get them from other really heart healthy fat sources and other nutrients. Like sometimes you might not be eating enough grain products, and those can be quite calorically dense as well.
Great insight. Thank you. Okay, so let's close out. There are a couple questions that just want you to expand briefly on your cookbooks. So one individual is asking for a good resource with recipes that are appropriate for PKD. They're asking if your books are specific to or are appropriate for PKD. And then someone else is begging the question if your books speak to PKD and CKD separately.
So the books are focused on CKD, but they do have a lot of really balanced meals. In terms of the big difference between a PKD and a CKD diet, it's really about the amount of protein that you should be having. At the end of the day, we're both incorporating a lot of fiber from those vegetables, whole grains, lots of those plant-based proteins. So these books are great if you are looking for some new recipes. They don't talk about PKD specific recommendations, but we do have something coming out shortly that helps support you with that.
We absolutely do. So I encourage everyone to stay tuned for some exciting developments in PKD-centric cookbooks in the new year with our friend Emily here. Okay, so in the interest of time, we are going to wrap this portion of your presentation up. I thank you wholeheartedly for such an amazing, highly educational presentation, Emily. It's always a pleasure to speak with you. And we are now going to take a little bit of a health break. And for the next 35 minutes, Emily has pre-recorded a cooking demo for us to enjoy. And also we can take this time to stretch our legs, fill our water bottles, and of course, get something to eat. So Emily, thank you so much for joining us today. Look forward to being in touch soon and for the big things that we're going to roll out in 2024.
Thanks for having me, everyone.
Bye-bye.